So the post-emergency canvassing operation, PECO, is a door-to-door canvassing operation that is coordinated by the New York City Department of Health and Mental Hygiene. The goal of PECO is to identify residents that have post-disaster critical needs, and we try to connect them with essential city services that are being offered after a disaster. The tent city provides the New York City Department of Health and Mental Hygiene the ability to coordinate large field operations anywhere in the city, especially those areas that have no suitable existing structures as a result of a large disaster. The tent city consists of 6 tents, including generators, light packages, wiring harnesses, heating, air conditioning, and ventilation systems. In the PECO context, the tent city is utilized as a canvassing assembly point, or CAP. We wanted to test 2 specific things. The first thing was a transport piece about being able to get all the equipment that's involved with building the tents, as well as newly trained staff, testing their ability and knowledge as it relates to actually building the structures. We have 1 tent, which is a command tent. That's where the canvassing assembly point, the command staff work out of. We also have workspace for partner agencies to help solve field level issues and to help coordinate field level responses. This is the personnel and equipment tent. This is where the arriving canvassing workforce will be registered and assigned to one of 20 strike teams. They'll be issued their equipment, including tablets and radios. Each canvassing assembly point, when fully operational, can deploy 440 canvassers out into the field. We have a logistics tent, which primarily is used to store equipment not only for the canvassers, but equipment that's used in day-to-day operations of the canvassing assembly point. We have a just-in-time training tent. This is where the canvassers receive an in-service training on all the field equipment they'll be using. They also receive instructions on the best practices for engaging with community members that have disabilities, as well as limited English proficiency. With our community partners, we've been given some feedback and developed tools that will assist the canvassers in accommodating the diverse needs that the residents that they may encounter while conducting the canvassing operation. We also have an operational briefing tent. This is the last stop for the canvassers before they actually go out into the field and start the canvassing operation. Here we discuss the incident action plan, which gives the canvassers an overview of the mission for the operational period. We also pay very particular attention to safety. We want to be fast and efficient, but we want to do it in a very safe manner and try to minimize any risk to the canvassers that they're going to experience in a post-disaster environment. We have a community engagement tent, which is one of the more important tents in the tent city. This is where we ensure that we're engaging and supporting our community partners in the areas that we're actually canvassing. We gather information on local recovery resources that the canvassers can actually share with the residents while they're canvassing. We also have a language access team and a disability access and functional needs team that will resolve complex problems in the field. They also request resources to ensure that all residents are receiving the same access to the services that the operation is providing. This exercise provided the New York City Department of Health and Mental Hygiene a great opportunity to work with our partner agency, the New York City Fire Department's incident management team. We've seen that the New York City Department of Health and Mental Hygiene has the ability and capability of delivering a large tent city for deployment to help support field operations in response to public health crisis. We were able to meet all of our objectives. We had no issues. We were very happy with the results.